Okay, so today we're going to be doing a complete nail avulsion for a painful, thickened nail on the hallux here on the left foot. And if you're more comfortable, you can go ahead and lay down, unless you want to watch, up to you, okay? All right, so we're going to really numb up this toe. We're going to be doing an H block to be able to get all 4 quadrants at the base to numb up the entire nail bed. Really cold. You're gonna feel a pinch and a burn. 1, 2, 3. You're gonna feel some pressure. Nice deep breaths for me. So we're infiltrating the upper lateral quadrant. We've gone all the way deep. Have laid some local there. Now we go across. We raise a wheel on that side. That way, when we go to do our last stick, it's not as painful. 1, 2, 3. Do you feel that? Mm-hmm. Okay, that's the worst part. You're all done. Mm-hmm. So we're gonna give that a good 10-15 minutes for it to really take effect, and then we'll come out and do the rest. So we've already done an H block on the toe. Toe should be nice and numb. Okay, so we're gonna test it. You really can't feel much up there? No? Okay.
If you're doing anything, I don't feel anything.
All right, let me know if this is painful. Feel any pain?
No.
Okay, our patient's nice and numb. So we're gonna put a little toe tourniquet on here. So when did you have that procedure done? Because it looks like you had an ingrown procedure done a long time ago.
Yeah, I was 16. Like
16?
40 years ago.
So you can see the patient's already had a partial nail avulsion with what looks to be a matrixectomy, but he's got a spicule of nail that's still kind of coming through at the base there. That's pretty painful for him. So we talked about the options of removing it completely and seeing if a new nail will grow back better, or just removing it permanently by doing a complete matrix phenolization. And the patient has decided that we want to just go ahead and get rid of it completely, right? So yes. Hopefully it won't come back. All right. So the first thing we do is we like to lift the nail off of its attachments. A little painful?
No.
You sure?
I'm good.
Let me know, because we can give a little bit more local, okay?
I'm fine.
You doing okay? I'm watching you up there. Okay?
Yeah, I'm okay.
All right.
I don't want to watch.
Okay, don't watch. So we just carefully go around the nail, making sure that we're lifting the skin edges neatly so as to not traumatize the skin as much as possible. So I just gently push around the nail until the freer elevator just gives, and that tells me that we're free. The nail's almost always really attached at the medial and lateral corners at the base. You gotta just give it a little bit more pressure to be able to get down there. No pain?
No.
Okay.
I just feel...
You'll feel pressure,
yeah,
but no pain. Okay? All right, good. So as you can see, the nail now is already pretty loose. So you can see the medial border is already wanting to come loose. Okay. Okay. And now we just kind of lift the nail, and there it is. It is off. All right, hallelujah, right? So now I'm going to remove that little spiculate you had from that previous procedure. That we're just going to remove it with a little tissue nipper. Doing okay?
Gee, I want to cheat.
Okay. Now let me get a curette. We're going to just scrape the matrix, and that's just going to help us be able to phenolize the matrix more successfully. One of the things with a complete nail avulsion with complete matrixectomy is that you will have a little bit of the nail that may come through. And if that happens, we just remove it later on. But hopefully by taking these steps, it won't come back, okay? Doing okay?
Mm-hmm.
He's sweating.
I sweat when I get nervous.
Well, it's all done. Okay, so we're all through. Okay?
Cool.
We're just gonna put the medicine, then put a dressing on there, and you're all done. Okay, so the nail's off and all looks good. So let's get some cotton tips. So now we're gonna phenolize the matrix. We're going to do 3 applications, 30 seconds apiece. So we're just going back and forth, making sure that we're getting the medial and lateral corners. And you can see the tissue starts to get a little dusky gray. And that means that the phenol is working. You feel any of this?
No,
No? Okay.
I feel you're working on it.
But no pain. Okay. All right, last application of the phenol. Okay. And now we irrigate it out with alcohol to neutralize the phenol and wash anything out. Okay. There's just a little piece of skin here that needs to come off. Okay, everything looks good. So here was what we removed, if you want to see.
Ugly.
Yeah, it's a pretty ugly nail, huh? It's gone.
Mm-hmm.
Okay.